Hey folks, it's Carl over at Sterling Health and Fitness. Thanks for tuning in to another episode of Ask the Expert. So today, our topic is going to be oral health and the athlete, or oral health and the active person. The mouth is the gateway to the health of our body, and I can't think of anybody more qualified to speak on this than not only my own personal dentist, but a very, very good friend, Dr. Evan Scott Gross.
Hey, Carl.
Thank you.
Thanks for inviting me.
Thanks for being with me on this. I appreciate you taking the time.
Pleasure.
And you'd prefer to be called Scott.
I do.
All right, Scott. Well, Scott has over 30 years experience as a dentist.
Mm-hmm.
And we've had some interesting conversations. We've known each other for a few years. Like I said, he's a good friend and he's a great dentist. And he's enlightened me on how important it is with a lot of different relationships and various things we're going to talk about today as far as what you put into your mouth and how it affects your health overall, the health of the body. And of course, we have the obvious, which is, you want to be eating good food, get your calories from nutrient-dense foods. But it goes beyond that. So I have some memory jogger notes here.
Good.
So just to start over here, again, with our main theme is the mouth is the gateway to the health of the body, but more so than in just what you eat. We have, let's talk about the, obviously how we nourish our bodies is by eating. We eat food. Athletes, active people, what I find really interesting when we were talking off camera is how athletes tend to have flat teeth sometimes.
Many times they do.
TMJ. And sometimes the digestion of the food is different than it would have been if they... And I'm going to let you run with this because this is a really interesting topic.
Well, being a dentist, we see all types of people.
Mm-hmm.
We see very, sedated people who don't have an active lifestyle, and we see very active people, and especially those athletes who are not only doing their sport, but they're training for their sport. And what they don't see or what they don't maybe realize is the effects that they have on their mouth. Now, if you watch an athlete train or you watch an athlete do a sport, you can see them tensing up. You can see them grinding their teeth. You can see them clenching their mouth. Mm-hmm. So not only does it put stresses on which are paranormal or abnormal and can be deleterious and malfunctioning, but they also tend to put great stress on their teeth. So you've heard of stress fractures in bones?
Yeah.
Teeth have stress fractures all the time. If you look close enough at a tooth under the right light, you'll see 1,000 cracks in every tooth.
No kidding, really?
Sometimes it makes a difference, sometimes it doesn't. But many times what you'll do is you'll just, molecule by molecule, electron by electron, just wear down the teeth. So you look at an athlete a lot of times, and their bite is just straight across. So what that does is they lose the edges of their teeth, which are used for tearing and biting, incisors in size, right? Canines tear. And so all their teeth are functioning like back teeth. The molars, which are there for grinding. So if all their teeth are all of a sudden grinding, then they're putting just even more stress on their teeth.
Wow.
And it just gets more and more and more until they either wear their teeth down to nothing, or they break, or they wear into the pulp, and they need root canals, and they need crowns. And so that's never to stop anyone from being an athlete or athletic or active, but you just want to take into account the possibilities of doing damage to the one system of your mouth that is required to get the nutrition in order for you to train, in order for you to be balanced in general. So you want to take care of the mouth and the teeth.
And digestion starts in the mouth.
Digestion starts as soon as you put something in your mouth. The reason you salivate is to start to break down the food so you can swallow it. And the rest of the stomach acids and everything does everything else. But you need to get it past the teeth. Many times, what you're eating or what you're drinking has a lot of sugar in it. I mean, the sports drinks, nutrition drinks, great, sugar for energy, salts for electrolytes and minerals and all that kind of stuff. But it just lays on the teeth. It lays on the gum line. Again, if you look at a lot of people who drink this stuff all the time, they have little scalloped, demineralized areas around their teeth, and they get cavities right at the gum line. They also get gum disease, which we'll talk about those effects on the heart later.
Yeah, I have a note to get to that. So let's go back, though. I want to talk about this digestion. Of course, in nutrition school, when I was in a nutrition program at SU, the first thing they teach us about digestion is it starts in the mouth. And I think a lot of us we don't think about that, but
Most people don't.
some of us know, but a lot of us, I didn't know, so now I know. But it's interesting. So, is it changing that digestion of the food? Are you saying because of their inability to maybe chew is effectively, or
Well,
are
certainly.
the enzymes changed? I mean, how is it affecting?
No, the chemistry isn't changed, but the actual function of the teeth will change. So, what that means is that many people will shy away from a certain type of food because their teeth aren't able to get through it.
The inability to eat it, basically, and
Exactly.
comfortably.
Exactly. So if you want the best variety of food, it's going to need to be cut, it's going to need to be incised, it's going to need to be torn, it's going to need to be chewed. And all the different teeth have those different functions. And if all the teeth are functioning basically like one, you may shy away from something that's really good for you. You may not want to, bite into an apple because you can't. And apples are good for you. They're not good for your teeth, by the way.
Interesting.
The apple a day keeps the dentist in business. Really, there's a lot of sugar in apples, but that's not to say don't eat them. Eat them, but rinse your mouth, floss, and brush afterwards.
Okay.
But some people will shy away from that because they just don't. What if their teeth are sensitive because they have so many fracture lines in there? They're sensitive. Okay, so they're not going to get into a cold piece of fruit or maybe a salad.
Okay.
And, so if somebody's just eating, something that's easy to swallow just because it's easy to swallow, then you get into the problem where they're not actually grinding through the food, which is self-cleansing. Now they're just laying the sugar right on their teeth, and there's no self-cleansing to it at all. Lots of foods are self-cleansing. Celery and carrot sticks and all that. They really, because they're abrasive and fibrous, they actually clean the teeth. Also nuts, also aged cheeses do a similar type of thing as far as limiting the acids put on the teeth.
Interesting.
So
okay.
you want to maintain the health of the teeth so that you can eat the proper foods that'll help you train.
Okay. All right. So talk to me about TMJ real quick.
Okay. TMJ is an acronym that stands for temporomandibular joint. So the temporal part of the head, the mandible, temporomandibular joint. Right in front of the ear is a ball and socket. And inside the capsule where the ball and socket is a little cartilage disc. So many people hear clicking when they open their mouth real wide.
Right.
And so that cartilage disc is getting held up because the mouth is being overburdened by chewing gum, paranormal habit, very bad for you.
Okay.
But the grinding and the clenching, sometimes at night, sometimes during the day, it's a very stress-related phenomenon. The body, that's the way the body reduces stress, by clenching and grinding.
Yeah.
But it can have such a terrible effect on the joint by pulling the muscles, tearing the muscles and the ligaments around that. Very, very painful.
Okay.
And it's very, very common. So, and athletes have a lot of burden on their face.
Yeah.
Because of this clenching and grinding. Some people can handle it, some people can't.
Okay. That's great. So we're talking about TMJ, and that makes me think of mouth guards. And you and I were talking off camera about those. I wonder if you could share about mouth guards, because a lot of people think they can just go out and buy one at the store, and that's cool. And you said something different about that to me.
Well, there are different types of mouth guards for different reasons. And so a TMJ mouth guard to actually help avoid TMJ symptoms is something that's usually, can be worn at night, can be worn during the day, but it's of a different type of angle, material, et cetera, et cetera. If you don't have TMJ, which hopefully you don't, but if you just want to relieve all the tension and the stress and chance of the stress fractures from the teeth, you should be wearing a mouth guard, an athletic mouth guard, when you train or when you do sports. You see, well, look, I think it's pretty much regulated that a lot of people in professional sports have to wear mouth guards.
Yeah.
And that's basically because you're getting hit with an elbow or something like that. We're talking just the stress of grinding your sport out.
Yeah.
So, but you don't want to get a stock mouth guard because they fit.
Yeah, why is that?
Because they fit like socks on a rooster. Now, I say that in jest,
Yeah,
but
it's good.
It's really the way it is. And in fact, I just had a patient the other day. She's been wearing a department store boil and bite mouth guard for 3 years. When she takes that out, only 2 teeth touch.
Wow.
So wherever they don't fit, the teeth will move to make something hit.
Oh, wow.
A tooth will move until it hits either another tooth the ceiling or the floor, depending on if it's an upper tooth or a lower tooth. They will extrude. They don't grow. They extrude. They lift right out of out of the socket. So you need a custom-made mouth guard, which is very simple. You take impressions. You go to the dentist. You take impressions.
So something a dentist will do? As an ortho person or an orthodontist or a dentist?
Dentist.
Cool. General dentist. Yeah, because I actually didn't know about that. That's interesting. That's cool.
Now, orthodontists can make mouth guards for their orthodontic patients that happen to be very active and athletic. Okay. They're best suited to do that. But if you don't have orthodontic brackets and bands on, your general dentist can.
So that's something you do then.
Absolutely.
Yeah, that's good to know.
Absolutely,
real good to know.
And they're comfortable. See, and a lot of kids complain to their parents, "Oh, I can't I can't talk, I can't swallow with the boil and bite mouth guard," and that's very true.
Yeah.
But when we make them, they're very low profile. They're thick enough for protection, but they're thin enough that you can talk with them. You can swallow with them, and you can communicate. If you're a quarterback and you want to talk or something, you need to talk. You can do that with these mouth guards, and they fit very comfortably.
Oh, that's good to know. Okay, yeah. So, well, let's go back. I know I have to go back now. We're backtracking to the sugary drinks again because I remember something I had forgotten to ask that we'd spoken about this a couple times previously, off camera, but. Tell me about the every time you take a sip, basically. If you're sipping on a soda for a half an hour, what's actually happening? Because this is really interesting. I had no idea.
Most people don't.
Yeah.
So you obviously need to intake sugar because the body breaks it down and you get energy from it. But the mouth and the teeth do not like sugar. And so every single time you take a sip or a bite, but if you introduce sugar into the mouth, every time there's 20 minutes that the acid in your mouth goes below 5.5.
Okay.
When the acid level, on a scale of 0 to 14, 7 being neutral, it goes below 5.5. You have demineralization of enamel. You start getting decay.
Wow. Okay.
20 minutes. So you take a Coke, or no brand products. You take a soft drink, and you sip it. 20 minutes, the level goes down. Now, what if 15 minutes later you take another sip? Clock goes back another 20 minutes.
Wow. Okay.
People are drinking 6 packs of this stuff a day.
Yeah, I know. And so what are some other drinks that have that? I mean, there's tons of energy drinks.
Everything but water.
Okay.
Everything but water has that. So does that mean you should never have a sports drink? No. But you should be sipping water in between.
Okay. So
now,
like you just have water after, let's say, a sip of an energy drink, then it's going to help. It's probably not going to alleviate that setback, but it'll help.
It's going to help buffer that acid.
It'll help a lot.
And bring it back closer to 7 now. So if you take a drink of a soft drink, but that also means, look, coffee with sugar, tea with honey. People don't think of these things. So all you do is, and if you're out in the field, you can spit it out. It doesn't matter. But rinse that acid out because it's just sitting at the gum line. Will give you inflamed gums, gum disease. It'll also give you cavities.
No kidding. So you mentioned tea with honey too. I know quite a few people who drink tea with honey.
Honey's wonderful for your body, not good for your teeth. It's
no
the same
kidding.
apple thing.
This is really okay. Apples, honey, any other?
Everything.
Enlighten me.
Everything.
Yeah.
I mean, then you have people eating a lot of citrus fruits. Boy, it's great. Vitamin C, et cetera, et cetera. Acid. Yeah. So not only are you making the body make acid, you're introducing acid, and it's staying there. So wonderful. Just the key is rinse with water.
So a good rule to follow then is rinse when you're eating or drinking anything, basically.
Rinse, swish, swallow. Rinse, swish, swallow.
All right, cool. Now, that's really interesting. Okay, good. Well, this brings me to another area where we talk about heart health in relation to the health of your mouth, teeth, gums. I've heard some things, and we were talking again off camera about this. This is fascinating.
Well, the recent studies in the last really decade and a half, 2 decades, have shown us that many people who have had heart disease and have actually passed away due to severe heart disease, we've noticed that the bacteria in the heart just happened to match the bacteria in their gums when they had gum disease. And so what that's telling us is that everything is connected. Head bone's connected to the neck bone, blah, blah, blah. Well, the mouth is connected to the heart and the rest of the circulatory system and all the vital organs that enable you to be active, have an active lifestyle. So when you don't take care of your mouth, it could kill you now.
Yeah, really.
It could kill you.
Really, that's interesting. Man, I mean, so theoretically, not theoretically, I mean, in reality, the more you take care of your oral hygiene, the less chances of heart disease and
in that variable.
and
Now,
other
if you have genetics that are going to give you heart, that'll reduce your immune system, for different diseases, you're going to have that anyway.
So that's a different thing.
But there's always the genetics, and there's always the environment. Okay, and those two will affect your life. You can do a lot to the environment that you put your body into. Genetics, you're going to have a hard time fighting that. Someday maybe we'll have all that, but right now it's the environment. So think of the mouth environment.
That makes sense. That makes a lot of sense. This is great information. Yeah, I appreciate you, again, taking the time and sharing. So,
my pleasure.
If we go back and recap here, let's see, what was our title basically is, we're talking about athlete and active person, and how important it is to take care of your oral health in relation to athletics, being active, getting nutrition. But this really goes for anybody, because we all eat. We all need to take care of our oral hygiene. Just recapping.
The mouth is the gateway to the health of the body.
You said it. So with most of these videos, I'm usually listing a website because people are trying to grow their business. And in Scott's case, he's not trying to grow his business. He's trying
my business the way it is.
He's trying to keep you away, actually, which is...
trying to put myself out of business.
Yeah.
Be healthy.
No, that is really good. I'll have some contact information at the end of the video if you want to reach out to Scott. If you have any questions at all, he said he's glad to answer. Well, I appreciate that a lot, too. So remember, take care of your teeth. Take care of the health of your mouth. And stay tuned. Be sure to check out sterlinghealthandfitness.com. There's a lot of different interviews. We try to just make sure we're delivering the best information that we can get to you to help you in any way we can think of to live a better quality of life, improve the health and the quality of your life. So thank you again, my friend.
Pleasure.
All right.
Thank you very much.
This was great. Thanks for tuning in, everybody. All right. Have a good day.